If you are over 65, there is something I want you to hear very clearly today. Your body usually does not go from fine to serious trouble all at once. Most of the time, it gives small daily signs first. A little more tired than usual. A little more dizzy. A little more swollen. A little more forgetful. These changes can seem harmless, and that is exactly why so many people miss them. But here's the part many people miss. Small signs that show up every day can be your body's quiet way of asking for extra care before a bigger problem begins. I'm Dr. Amelia Watson, and if you've been feeling not quite right, this conversation matters. Maybe you wake up tired even after sleeping. Maybe you feel lightheaded when you stand up. Maybe your shoes feel tighter by evening. Maybe you are drinking water, taking your medicine, doing your best, and still wondering why your body feels different. These are common senior health concerns, and they deserve attention, not shame. Today, I want to walk you through 7 daily signs your body may need extra care, and one of them is so easy to brush off that many good people ignore it for months. The first sign is unusual tiredness that does not match your day. I am not talking about normal aging or feeling sleepy after a busy afternoon. I mean the kind of fatigue that feels heavy, foggy, or strange. You do simple things like make breakfast, fold laundry, or walk to the mailbox, and you feel more worn out than you used to. That matters because daily fatigue can show up with poor sleep, low fluids, low iron, medication side effects, blood sugar changes, heart strain, or other health issues. If your energy has changed and it stays changed, don't just call it old age. Your body may be asking for a closer look. The second sign is feeling dizzy, weak, or unsteady when you stand up. This is one of the most important warning signs after 65 because it can raise the risk of falling. Sometimes it happens when blood pressure drops too fast after standing. Sometimes it can be linked to dehydration, not eating enough, infection, inner ear problems, or medicine that needs to be reviewed. If you have to pause after getting out of bed or hold on to furniture more often, pay attention. A small moment of dizziness can lead to a big injury, and that is why this sign deserves respect. If any part of this sounds familiar, let me know in the comments. Tell me your age, or tell me which daily sign you've noticed lately. I read those comments carefully, and they help me know what videos will help you most. And if you have a parent, spouse, or friend over 65, share this with them. Sometimes one caring conversation at the right time can make a real difference. Now let's keep going, because the next sign is one many people see every single day and still explain away. I'm talking about swelling in the feet, ankles, or lower legs. If your socks leave deeper marks than before, if your shoes feel tighter by evening, or if your rings suddenly feel snug, your body may be holding on to extra fluid. Sometimes swelling comes from sitting too long. But there's another reason it matters. It can also be linked to circulation problems, vein issues, heart strain, kidney problems, or side effects from certain medicines. Mild swelling is not always an emergency, but new swelling, fast swelling, or swelling with shortness of breath should never be ignored. If one leg becomes suddenly more swollen, warm, or painful, get medical help quickly. Another daily sign is needing to urinate much more often, much less often, or noticing stronger thirst than usual. Let's make this simple. Your bathroom habits can tell you a lot about hydration, kidney health, blood sugar, and even infection. Maybe you're up several times a night. Maybe your mouth feels dry all day. Maybe your urine is much darker than usual, or you feel tired and headachy in a way you can't explain. These changes do not always mean something serious, but they are not random either. In older adults, even mild dehydration can bring weakness, confusion, constipation, dizziness, and falls. And if you have diabetes, heart problems, or kidney disease, these changes deserve extra attention. Before making major changes to fluids or medicine, talk with your doctor or pharmacist, especially if you already follow a fluid plan. The fifth sign is a clear change in memory, focus, or mood that shows up in daily life. I want to say this gently. Everyone forgets things sometimes. We all misplace keys or lose a word now and then. But if confusion, brain fog, new forgetfulness, or unusual irritability starts happening more often, that deserves attention. It could be poor sleep. It could be stress. It could be hearing loss making conversations harder to follow. It could be a medication issue, dehydration, low blood sugar, infection, depression, or something else that needs care. Here's the part many people miss. Sudden confusion is very different from slow changes over time. If a person becomes suddenly confused, unusually sleepy, hard to wake, or is not making sense, that can be urgent and should be checked right away. The sixth sign is changes in walking, leg pain, or feeling like your legs are not doing what they used to do. Maybe your calves ache when you walk and ease when you rest. Maybe your feet feel colder. Maybe you shuffle more, trip more, or avoid stairs because your legs feel weak. These can be signs that your muscles, joints, nerves, or circulation need extra care. Many older adults think, I just need to sit more, but sitting more can sometimes make weakness worse. Gentle movement, the right shoes, a medication review, and a check on circulation can help uncover what is really going on. If walking has changed, do not wait for a fall to take it seriously. Now here is the sign I asked you to stay for, because it is so common and so often brushed off. A loss of appetite, early fullness, or ongoing stomach trouble. If food suddenly feels less appealing, if you feel full after a few bites, if constipation becomes your normal, or if nausea keeps visiting, your body may not be getting what it needs. That matters because poor eating can quietly lead to weakness, weight loss, low energy, worse balance, and slower healing. Sometimes the cause is simple, like not drinking enough water, low activity, dental problems, or side effects from medicine. Sometimes acid reflux, constipation, low mood, or illness plays a role. This is why I often tell my patients that digestion is not just about comfort. It affects the whole body, from strength to mood to brain health. When you step back and look at these signs together, a pattern appears. Fatigue, dizziness, swelling, bathroom changes, memory changes, walking changes, and appetite changes may seem unrelated, but often they are connected. One problem can feed another. Poor sleep can worsen memory. Dehydration can worsen dizziness and constipation. Too many pills, or the wrong mix, can affect balance, blood pressure, mood, and appetite. That is why one of the smartest habits, after 65, is a simple health review. Keep an updated list of medicines, vitamins, and supplements. Bring it to your appointments. Ask if anything could be causing tiredness, dizziness, swelling, or confusion. Never stop a prescription suddenly on your own, but do ask clear questions. A good review can sometimes uncover a fix that has been hiding in plain sight. I also want to give you a simple way to respond without panic. Notice what is new. Notice what is repeated. Notice what is getting worse. A symptom that happens once may mean very little. A symptom that shows up day after day is different. Write it down in a small notebook or on your phone. When did it start? What time of day is it worse? Does it happen after meals, after walking, or after taking medicine? These details help your doctor see the full picture faster, and they help you feel more in control. There are also a few red flag signs I never want you to talk yourself out of. Chest pain, pressure in the chest, severe shortness of breath, fainting, sudden one-sided weakness, face drooping, trouble speaking, black or bloody stools, sudden severe swelling, or sudden confusion need urgent medical help. That is not the time to wait and see. It is the time to act. The good news is that needing extra care is not a failure. It is wisdom. It is how strong people stay independent longer. The goal is not to be perfect. The goal is to notice what your body is telling you and respond early, kindly, and wisely. Small changes today can support better balance, better energy, better sleep, better hydration, and more confidence tomorrow. If you are over 65, or you care for someone who is, start with one simple step after this video. Pick one daily sign that stood out to you and pay attention to it this week. If something feels off, reach out to a qualified healthcare professional and talk it through. And if this message helped you feel a little more clear, a little more calm, or a little more prepared, leave a comment and share it with someone you love. I'm Dr. Amelia Watson, and I want you to remember this. Your body often whispers before it shouts. Listening early is one of the kindest things you can do for yourself.